Good afternoon, students. Today we're going to be doing knot tying, the one-handed knot, the two-handed knot, and the surgeon's knot, both with the cord as well as the real suture. So I'd like to start by having everybody start in this position. The reason that we have our right leg here is because I'm going to be giving directions like from the knee toward the ankle, those kinds of things. If you're using your left leg, everything's going to be backwards. So if you can put your leg in this position, this will be the starting place. Also, the left hand is holding the light colored suture and it's far away from you. The purple is in your right hand, which is closer to you. Everybody really needs to have the colors and the hands correct. If you're switched, the directions won't make sense to you. So left hand, light, far away, right hand, purple, close to you. So the way that you hold this, the suture, is just like you might pick up anything. So you're going to start like this. The first thing, all we're doing is just going to bring the hands together. And you'll notice that all we did was go from here to here, and you'll see almost like a TP. I call this the TP, or it looks like a V. And once you sort of see that V, you don't want to be way up high and you don't want to be way down low. Probably about medium, I guess. Halfway is going to be pretty good. You're going to take the left thumb and put it into the TP from the knee direction. Okay, so all we did was we made a teepee, we put our left thumb into the teepee from the knee toward the ankle, and you see it's in perfect position to receive the purple. Once you kind of put this purple on the finger pad, you can pinch with the left index finger, release, and push the purple toward your knee, re-grasp, and when you bring it down, you don't want to just kind of go down like that. You want to actually follow it down, ideally with your dominant hand. Let's just say for now, if we can use the right index finger, we're going to actually bring that down. That's half of a throw, so it's not a knot yet, it's just half of a throw. We're going to sort of cinch it down. The second step is the hook, and what you're going to do with this left hand is all we did is we hooked. Now there's half of you are going to accidentally hook this direction. This direction we don't want. You can see that the suture is in between the two. We want to hook so that the long part is coming off the lateral aspect of the hand. So when you hook, you want to have it hook like this. The purple simply comes over around the other side of the thumb. You make a circle, and this is where I lose some students. With the circle, I want to keep maintaining tension. If you release the tension, you're going to end up with an air knot, which I just kind of did. So here's the circle. All we're going to do is transfer the circle. Okay, so all we did was go from here to here. When you do that, you'll see that the finger pad of the index finger is perfect to receive the purple. You're going to pinch, release, a deliberate push through. This is important, these deliberate push throughs, so that you're not doing a reach in and grab. That becomes important when you have the little stuff. We're going to re-grasp, and then you bring color to color. Notice white matches white and purple matches purple, and you should memorize that. That is a perfect square knot. Of course, I would pull it more taut and I would follow my knot down, but that's the steps for the two-handed knot. Let's do that all again. So the left hand has the light colored suture far away. The right hand has the purple close to you. Make a V. Put your left thumb in the V from the knee direction. Purple goes over the top of the thumb. Pinch, release, deliberate push through, re-grasp, follow the knot down. This is important that you recognize my right hand is away. That's going to be important when we get to the little suture. We're going to pay attention to right hand away, and then the next step, left hand away. If you're going this direction or you're going this direction, things aren't going to work correctly. So the right hand is away, and it's easy to see with the colors, but in a moment it's not going to be so easy. We're going to hold tension. We're going to hook, and remember we wanted to hook this way. We're going to bring the purple over, make a circle, transfer the circle, receive the purple, pinch, push through, and the left hand is away, and you're going to follow your knot down so the colors match, white to white, purple to purple. One last time, a little bit quicker. So the steps are TP, follow your knot, hook, circle, transfer, and you'd follow it down. Okay, so that's a two-handed knot. Next we're going to do the exact same thing, but this one's called the surgeon's knot. The only difference is, of course, we start the same starting position. We're going to make our V, or our teepee, put our thumb through, and we're going to go through 2 times. So here's the first time. Immediately the thumb goes right back in. A second time, when we bring it down, you'll notice that this stays a whole lot better. So we want to utilize this in areas where we really want that first knot to be secure. So everything else is the same. The hook and the circle is all just one time, and here is a surgeon's knot. So you'll notice the difference. It looks exactly like the square knot that we did a minute ago, but there's an extra sort of twisty on one side. Okay, so let's do that one again. So this is the surgeon's knot. Let's say you're placing 4 knots in a row. The first one's going to be the surgeon's knot, and all the others are just regular square knots. So the only time you go through twice is the very, very first one. It's for security. So here we are, teepee. We're going to go through 2 times. Right hand is away, and I followed my knot down. Now I'm doing the hook. And again, my left hand is away, and I would follow my knot down. And that's going to be your surgeon's knot. If I wanted to continue, I'm just going to bring the suture ends up, and there's my starting position for my next knot, which I would just go through 1 time. Right hand is away. Left hand is away. Right hand is away. Left hand is away, and we continue. And you know, we'd be pulling these much more taut, but you're going to see perfect knots stacked up. So at this point we're going to go to the little stuff and just repeat those 2 things that we just talked about. So we're going to sew in this direction. Lots of times in the OR our patients are lying in this direction, so rather than the ER setting where we got to sew toward ourselves, we're actually going to be sort of sewing or tying rather side to side. So I would encourage you to start in this position like this. The idea is, and this may pop up, but we'll try to keep it stable here, is if the surgeon just held these 2 free ties up and said, tie for me please, the way that I grasp them, I always want to grasp, we'll say they're up in the air, the far away one with my left hand. If I grab the far away one with my left hand, I'm in perfect position to start. You don't want to just grab them and then be trading off and trying to figure out like this. By the time you finagle around, they're pretty much done with you, and you're not going to get a chance to do this. So when they hold it up and say tie, just remember, left hand is away. Okay, that was the starting position that we started with. And again, what I may do just to keep this, hopefully you'll be able to see this. This may pop out. Let's give this a try, just so it doesn't pop up a lot. So our starting position was left hand away, right hand was toward. We bring the 2 ends up and put our thumb in from the knee direction side from what we talked about before, over the top, pinch. Let's go ahead and do a surgeon's knot on this one. 2 times through, right hand, and you can choke up, is away. A hook, the circle transfer, and this time left hand is away. So we're going to keep going with that. There's our starting. This one's only going to be 1. Right hand away, left hand away. Right hand away, left hand away. And I'm exaggerating pulling up because I really want you not to let go of your tension. Okay, so the 2 are up in the air. This is the starting spot. Pinch, push through. Right hand is away, completely perpendicular to the wound. Hook, circle transfer, still holding tension. Pinch, push through. Left hand is away. That's our 2-handed knot. Okay, we're going to go on to the 1-handed knot. The 1-handed knot is very useful for deep areas where you can't get your 2 hands in there. And also, we're pretending that almost like we had an instrument in our hand with a needle on it, and we've passed the needle through some tissue, maybe popped the needle off, and we have a free tie, or actually, I'm sorry, we didn't pop the needle off. We want to keep the needle on there so we can keep tying with that same suture. So we passed through tissue, we're going to tie with 1 hand, somebody's going to cut for us, we're going to continue to use that suture, tie with 1 hand, somebody's going to cut for us. So the idea is if you're right-handed, you have an instrument in this hand. So on the one-handed, the left hand is going to do all the work. The right hand's just going to kind of move around a little bit, but it's not going to really do anything, whereas before, the right hand had a job and the left hand had a job. Okay, so basically, this is the same starting position. We've got the white in the light, far away, purple toward us. And the starting position is simply going to kind of hold like almost like a little 6-shooter here. Okay, so you want to kind of, the first step is probably the hardest, getting your hand to be in this position. Okay, what I find students, if they have their fingers straight, they have difficulty. Try to bend the index finger and try to also have this thumb help push, because what we're trying to do is sort of straddle this purple and go around the purple with the left index finger, and we're going to grasp the white like that. That's the first step. We want to go like so. You don't want to just flip it through. You want to just turn your hand so that you're bringing it through, You can slide this finger over to grasp it. That's step one. And again, you're going to follow down probably with the left index finger because our right hand's busy with an instrument. That's step one. We'll come back and do that in a minute. Next, we're going to do what's called the supination maneuver. So basically, you're holding the index and thumb in the white, and you're going to supinate. So some of you are going to accidentally supinate like this. But notice there's nothing over on my little finger side if I supinate like that. This one doesn't count, it's the free end. I want to supinate so I feel the tension in the lateral aspect of my hand. So make sure when you supinate, it looks like this. Once you've done that, you can bring the purple down, and where we're heading for is this white right here with this finger. We're going to bend that finger down. Once we get it, we pinch between 3 and 4, release with 1 and 2, and just back the hand out. And again, white to white, purple to purple, and again, we probably follow down with our left index finger. There's your perfect square knot. So let's do that again. Some people ask, could we do a surgeon's knot on this? Could we go through twice? You actually could. We typically don't, but you could. But here we are. This is the beginning. We're going to go around. Step 1, supinate. Step 2. Okay? If you did 2 steps in a row, you're going to get a granny knot. And I would recommend that you do these in the order that I've shown you. So in other words, don't do supination first and then this one. You're going to have more difficulty with that. So here we are at the beginning. We're going to go ahead and places that students have difficulty. They try to do something here where they go maybe over. It's actually right in here. Use the thumb to offer that suture. And then a lot of times they want to do a reach in and grab where they actually kind of reach in and grab the white. If you just turn your hand, you bring it all the way through. This is going to be important when we have the little stuff that you have control of it. And you'll notice my right hand is away again. Okay? And now supination, pinch, release, left hand is away, just like what we talked about before. And then you can continue with step 2. Right hand away, left hand away. Right hand away, left hand away. And you're going to end up getting these nice stacked knots. So let's try that with the little stuff. If you're finding that you're not following your knots down good, if you have one of the suture boards that has a cup still attached to it, if you tie in that cup, it will force you to follow the knot. So you'll know what that means by following the knot. Okay, so let's see if we can secure this a little bit again. Get this out of our way. Okay, so the same starting position. Remember, our left hand was away. We just grasped with our left hand. Maybe we have an instrument again in this right hand. So step 1 is right here. And right hand is away. We're going to follow the knot down. Supinate. Left hand is away. Right hand is away. Left hand is away. It's really important they're looking for that if your hands cross perpendicular. The other thing that I notice a lot of students do is when they actually come down, they don't come down flat in this plane. Let me go back to this just for 1 second because this is another pitfall where we're at this place when we're getting ready to bring it down. If your suture ends are up in the air, when you actually cinch it down, you're going to have more difficulty than if you're flat. Sometimes you can't get flat, but go as flat in this plane as you can get. Let me show you what happens if you don't. You'll kind of have something that looks like that. And you really want it to be more like little stacked circles. So the more flat you are, the better it's going to be. So instead of having them up when you cinch it down, try to be in this plane. That's real helpful. Okay, I think that explains the one-handed tie, the two-handed tie. And these are really meant both for the right-handed clinician. However, if you're a lefty, you're going to have some advantage where the left hand gets to do a lot. Ideally, everybody should be able to tie right-handed and left-handed, but I don't want to get people confused. For now, everybody should try to tie this way, whether you're a righty or a lefty. And it depends on the side of the table that you're on, but this is really going to be the best for you, even if you're a left-handed person.